Hi, everyone. We're back, and the topic for discussion today is we're actually on session 69, quiz 2. And today our topics are going to be what is the EKG, what is DVT, what is a CAT scan, and what is an MRI. So our first quiz question is, what is the EKG? Well, the EKG, as we know it, is called actually an electrocardiogram, and it is what is called a diagnostic test. Typically what happens with people who have an EKG done, their questions raised, sometimes they have chest pain or other symptoms of cardiac problems, and the doctor orders it so he can find out if are there any EKG changes which are significant. And for that reason, an EKG is done. Typically, they're done in the emergency room, they're done in the ICU. They can even be done on a surgical floor or in many different places, the doctor's office. The important thing is it's done to diagnose a cardiac situation because it is a diagnostic test specific. It's non-invasive and it's specific to something to do with a cardiac event. And it does really actually give a lot of information, and you can read the example that I've given there on that image to learn more. What is DVT? DVT stands for deep vein thrombosis. And deep vein thrombosis, it can be seen in virtually any patient who's been in bed for a very long time. Typically what happens if that patient is in bed for a long time, patient's not been moving around much, the circulation is not going, a blood clot can form. And so here are some suggestions. If you should be that nurse taking care of a patient who has been in bed for a prolonged period of time and starts to complain of pain in the calf, hot, sometimes the calf gets hot and red, it might be suggestive of a deep vein thrombosis. So you may want to notify the doctor. And some of the preventative measures that are taken, of course, they're medications they give, but there are also the sequential stockings that they put on and the TED hose that they put on, and these are very wonderful ways of preventing them from getting progressively worse or even starting up at all. Next we go to what is called a CAT scan, and a CAT scan is, its proper name is computed axial tomography. And it's done depends on what the situation is. The doctor decides what he wants to do. In this case, there's this man, here he is, Bill, he's been having headaches for a while and for the last few weeks and behavioral changes, and the doctor suggests that he have a CAT scan. When a CAT scan is done, they're usually taken to a special type of x-ray that's done in slices. And one of the concerns is that sometimes, not always, patients might be given dye. If they are given dye, it's important to find out whether they have iodine, if they have any allergies to iodine, because they can develop a reaction. So dye or contrast dye sometimes is used and sometimes it's not. It just depends on the doctor, the situation, if he needs to be more specific. Sometimes it's not done with any dye at all. But anyway, the bottom line is this is a diagnostic test, and sometimes it's not necessary, sometimes it is to make a diagnosis. It's one of the tools that's used in making a diagnosis anyway. Sometimes a doctor may feel the need to order it, and sometimes he may not feel the need to order it. It just depends on the situation. So next we move into what is called an MRI. An MRI is called magnetic resonance tomography. I apologize for that. It's I take that back. It's called magnetic resonance imaging. I take that back. And here we have a situation with a gentleman who was struck on the head at a dockyard and fell on the floor. He had a cerebral bleed, and he was taken in to have an MRI done, magnetic resonance imaging. The problem with these, if you should ever be in an area where they're done, you have to take off everything metal, even like the clips in your hair, because you can really feel that energy pulling when you have it. You have to be sure that because it is very high voltage, and before patients go in, they do a screening to find out very specific things about the situation, like identifying body structures. If a patient is allergic to dye also, that's one of the concerns. And then, of course, another concern is to remove all metal objects, because once they get in there, those metal objects, I told you that you can actually feel the pulling towards, just pulling the body pretty much off of the table. It's quite a challenging situation. Anyhow, those are my quiz questions for today, and I just added this one too. Did you take note, nurse? Here you are, you've got a patient. The pill you left at the bedside is missing, and the patient is lethargic. And so we need to be careful. These are just some helpful suggestions when you take care of patients, not to leave pills at the bedside. Another thing is, here is another situation where you have an IV bag that's empty. Not very good. If you have a patient who's got an IV running in, my suggestion is, as it gets towards the end, even the last 100 to 200 cc's, get another bag ready long before it finishes, so you will not, just in case you go to the closet and find out there's no IV fluids left, and then you have to get from pharmacy, and that might take a while. I hope you have learned something from this. It's not a lot, but just something to... We do have tons of information for you on quizmenurse.blogspot.com and on patreon.com/dearnurses. And also, there's also dearnurses.blogspot.com with tons of helpful information. If you take a look at my other videos, you might be able to find topics of interest that can increase your knowledge based on the things that we've just discussed. Have a wonderful day.